1 in 4 women has insulin resistance. You might be one of them and not even know it. Insulin resistance doesn't always feel obvious. It's not like other health conditions with clear warning signs. Instead, it manifests as subtle changes in your body. Weight gain you can't explain, exhaustion despite adequate sleep, persistent cravings, mood swings, skin issues. Today, we're breaking down exactly how insulin resistance affects women's bodies, what it feels like, and what you can actually do about it. Let's start with the basics. Insulin is a hormone your pancreas produces. Its job is to help glucose, blood sugar, enter your cells for energy. Normally, you eat carbohydrates. Glucose rises. Your pancreas releases insulin. Insulin helps glucose into cells, and everything works smoothly. With insulin resistance, your cells don't respond well to insulin, so your pancreas keeps producing more insulin trying to get glucose into cells. You end up with excess insulin circulating in your bloodstream. This causes problems. Insulin resistance is incredibly common, 1 in 4 women, possibly higher. It's often undiagnosed because doctors don't always test for it. It's associated with PCOS, metabolic syndrome, prediabetes, and type 2 diabetes. But you can have insulin resistance without these diagnoses. Why does it happen? Genetics matter. It runs in families. Sedentary lifestyle contributes. Diet matters, especially excess refined carbs. Age matters. It increases with age. Some medical conditions increase risk. Some medications do too. The key point: insulin resistance doesn't mean you're lazy or have eaten too much. It's a metabolic dysfunction that can happen to anyone. Insulin resistance affects women differently than men. Here's how. Weight gain is one of the first signs. You gain weight despite not eating differently. Weight tends to accumulate around your belly. Abdominal fat is linked to insulin resistance. You might gain 10, 20, 30 pounds, seemingly out of nowhere. This is frustrating because typical weight loss advice, eat less, exercise more, doesn't work well with insulin resistance. You need to address the insulin dysfunction. Fatigue and low energy are extremely common. You wake up tired. Midday crashes are intense. Coffee doesn't fix it. This bone-deep exhaustion is real, and it's insulin-driven. Your cells can't efficiently use glucose for energy because they're not responding to insulin. Cravings, especially for carbs and sugar, are relentless. You want bread, pasta, sugar, processed foods. These cravings aren't a willpower issue. Your body is trying to get glucose into resistant cells, so it craves more carbs. It's a biological drive. Hormonal disruption is significant for women. Elevated insulin stimulates your ovaries to produce androgens, male hormones. This causes acne, excess hair growth, hair loss, and irregular periods. It directly contributes to PCOS symptoms. Mood changes and anxiety are common. Fluctuating blood sugar and insulin levels destabilize mood. You might experience anxiety, irritability, or depression that seems disconnected from your life circumstances. Difficulty losing weight is characteristic. You can diet and exercise, but struggle to lose weight because the underlying insulin dysfunction isn't addressed. Your body is storing fat more readily and holding onto it more tightly. Brain fog and difficulty concentrating happen because your brain needs glucose for energy. When your cells aren't efficiently using glucose, your brain suffers. Skin issues beyond acne, dry skin, inflammation, dark patches happen because insulin affects skin health. Acanthosis nigricans, dark patches and skin folds, is a classic sign of insulin resistance. Sleep problems can occur. Insulin affects sleep-wake cycles. You might have trouble falling asleep or staying asleep. Increased hunger, even after eating, is common. If your cells aren't getting glucose efficiently, your brain gets hunger signals. You eat but don't feel satisfied. Frequent infections, UTIs, yeast infections, or getting sick more often can happen because high insulin and blood sugar impair immune function. How do you know if you have insulin resistance? Your doctor can test for it. The simplest test is fasting glucose, your blood sugar after fasting overnight. Normal is under 100. Prediabetes is 100-125. Diabetes is over 125. Fasting insulin levels can be tested. High fasting insulin, despite normal fasting glucose, suggests insulin resistance. Normal is under 12 UIU/mL, but some doctors consider under 9 optimal. The OMA-IR score, Homeostasis Model Assessment of Insulin Resistance, is a calculation based on fasting glucose and insulin. A score over 2 suggests insulin resistance. A glucose tolerance test can be done where you drink glucose and your response is measured. HbA1c measures average blood sugar over 3 months. Ask your doctor to test these, especially if you have symptoms. Many doctors don't routinely check insulin levels, so you might need to request it. If tests show insulin resistance, that's actually good news because it means you can address it. Here's the practical part. What actually helps? Diet is foundational. Low glycemic index foods, whole grains, vegetables, lean proteins keep blood sugar stable. Avoid refined carbs and sugar. Include fiber and protein with every meal to slow glucose absorption. Eliminate sugary drinks. Exercise helps significantly. Both cardio and strength training improve insulin sensitivity. Even light walking helps. Consistency matters more than intensity. Weight loss of 5 to 10%, if you're overweight, improves insulin sensitivity dramatically. It doesn't have to be dramatic weight loss. Sleep matters enormously. Poor sleep worsens insulin resistance. Aim for 7 to 9 hours. Stress management helps. Chronic stress increases cortisol, which worsens insulin resistance. Meditation, yoga, or just stress reduction helps. Specific supplements might help. Inositol, a B vitamin-like compound, improves insulin sensitivity in many women. Dosing is typically 2 to 4 grams daily. Chromium, berberine, and cinnamon have some research support. Discuss with your doctor. Metformin is a medication doctors sometimes prescribe for insulin resistance. It improves insulin sensitivity and can help with weight loss and hormonal symptoms. Some doctors recommend intermittent fasting, though this is controversial. It works for some women, but not others. Discuss with your healthcare provider. Limit caffeine. Excessive caffeine can worsen insulin resistance in susceptible people. Prioritize whole foods over processed. Don't do extreme calorie restriction. This can backfire. Sustainable moderate changes work better. Why should you care about insulin resistance? Untreated insulin resistance increases risk for type 2 diabetes, which is serious and life-altering. It increases cardiovascular disease risk. It worsens PCOS symptoms. It makes fertility more difficult. It accelerates aging. It contributes to weight gain that's hard to reverse. But here's the good news. Insulin resistance is highly responsive to lifestyle changes. You don't need medication, though medication helps some people. Diet, exercise, weight loss, and stress management can normalize insulin sensitivity. Your symptoms improve, your energy returns, your mood stabilizes, your skin clears, your periods regulate. This is one of the most addressable health issues if you know you have it and are willing to make changes. The biggest barrier is often not knowing you have it. Many women suffer with symptoms, fatigue, weight gain, mood issues, without realizing insulin resistance is the underlying cause. Once you know, you can address it. Insulin resistance affects millions of women. It causes fatigue, weight gain, hormonal disruption, and skin issues, but it's highly treatable with diet, exercise, sleep, and stress management. If you're experiencing these symptoms, ask your doctor to test for insulin resistance. Get answers. Address it. Most women feel dramatically better once they do.